My name is Janna Wagner, and I am doing my book report on a book by June Faber called Smart Nursing: How to Create a Positive Work Environment. And the reason why I chose this book is because it's easy to read. It has a really good layout. It has tips and pointers at the end, a section of tips for nurses and a section of tips for managers. So I thought that was really interesting to culminate each chapter with both of those perspectives. And I also chose it because I work on the intermediate care unit at Erlanger, and we have an extremely high turnover rate. The average stay for a new grad on our floor is 6 months, and so I personally don't think our work environment is the most positive culture that it could be, and so I thought it would be interesting to read this book from that perspective. Um, and the author is she has written a lot of books, and she travels, and she does teamwork building exercises, and she works with nurses and managers, and she teaches seminars basically about how to create a positive workplace, for your employees and for your hospital. So she's widely known, and she has her RN and her MBA and also her BSN in nursing, and she has a widely varied clinical background. And some of the main points of this book, she identifies 6 building blocks, and respect, basically learning how to respect your employees, respect yourself, respect your coworkers is one of her building blocks. Another is simplicity, basically focusing on the basics, streamlining everything, eliminating red tape when it's necessary. Flexibility, being adaptable, creating a workplace in which your employees are adaptable, you're adaptable, and everyone, it just gives a little bit of leeway there. And integrity, maintaining a very highly ethical and workplace, focusing on hiring employees that have great integrity also. And another one of her 6 building blocks is culture, and just creating a positive culture where the staff feel like it's geared towards them. It's a staff-friendly environment, and she gives different strategies for doing that. And communication, which is a key ingredient to collaboration, and she also speaks about that and just various communication strategies and the importance of opening up the communication between the manager and between the staff and between the patients, and how that will create a more positive work environment. Um, Other main points is just basically how we can apply that. She talks about recruitment strategies, what kind of employee the nurse manager should be looking for, what kind of things to ask them, what kind of standards and morals you want those employees to possess, the importance of teamwork, and she discusses different team building strategies, as I've said before. Safety in the workplace is another thing she focuses on, and also diversity, making sure your workplace is a diverse place. And she also talks about different leadership strategies and how a true leader will take something that would be a catastrophe and turn it into an opportunity, and basically just looking for ways to make your floor better and to have more of those opportunities. And the end of the book gives tips for career acceleration, how you can use these strategies to basically accelerate your career. And also it has a section about how nurses can make a difference on their floor. A manager has a lot to do with the culture of the floor, but every employee actually has just as much to do with it as a nurse manager. So basically, this book is geared not only to nurse managers but also to nurses. And so there was a lot of main points that were very very consistent with leadership and management class. And so some of the ones I pulled out are, she talks about how you should use the Maslow's hierarchy of needs to create a good work environment, and basically like having safety and security and all those going on up the pyramid, but basically viewing your work environment in that sort of sense. So that's a theorist that's very, very consistent with leadership and management. And some of these I've already mentioned, but eliminating unnecessary complexity, making everything more simple, um, basically encouraging autonomy and encouraging critical thinking in the workplace, and basically when you do that, you're fostering a more creative environment, and so new growth can happen there. And hiring staff with integrity to create a culture of integrity, we already talked about that. And basically, back to the autonomy, just empowering nurses and, letting them have autonomy when it's appropriate, and that can actually encourage people to take more ownership of their floor and of the things that they are doing, and it'll actually save the nurse manager time. And she also points out that increasing diversity will decrease your risk of patient complaints, will decrease the risk of medication errors, all sorts of things like that, which I thought was interesting. And another thing is basically collaboration, relationship building, and collaborating with all the disciplines collaborating together. That really affects the culture of the floor. And I did not think that there were any points that did not fit with leadership and management. I felt that all the points in the book were consistent with the class, so that was fabulous. And so the last section is how can we implement all these things, and so um, some practical suggestions that nurse managers can use, or pretty much anyone can use, is hiring bilingual staff. That will increase your patient satisfaction, and it will just create the diversity that as a nurse manager you're looking for. Have a board or have some sort of system of positive reinforcement, like a warm fuzzy board or thank you notes and that kind of thing, and just letting people know that they're appreciated. Taking suggestions seriously, that's a component of effective communication, and just letting people, having them feel like they're heard and actually listening instead of just having them feel like that, taking their suggestions into account, and, trying to always make things better. Um, and another thing that I thought was important was explaining the management perspective, explaining where the nurse manager is coming from. A lot of times on my floor, she'll be like, we need this, we need X amount of patient safety satisfaction scorings, but she won't explain to us, why we need them, or the breakdown of what parameters we need to be falling in, and just if we knew the whys behind some of the things that we were just required to do, I think that would create a more positive culture also. A nurse manager can read widely, be in touch with new research with evidence-based practice, and being always trying to incorporate new research into her management or his management style. And I think the biggest, most important thing, and the thing I also agree with the most, is just having a stable pool of staff, and just not leaving your floor short-staffed. Having adequate staff to cover the floor, working within your nurse-to-patient ratios and not exceeding them, and that will just be a huge morale booster. Not having people come in short-staffed, and patients will be happier, things will run more smoothly. Just really have adequate staffing for your floor, and that will eliminate so many problems. And also hiring a staff with good attitude. There's a quote in the book that says, well, let me see if I can remember it, that you should hire for attitude and train for skills. And so basically just looking for attitude when you're hiring is also a big component of creating the culture that you're looking for. And then I have my references, which you may go look at your leisure on my PowerPoint. And thank you all for your time.